Okay, thank you all for taking time out of your day to come learn about PACE and all that we do and how we can help seniors remain living in their own home. Oh, I apologize. I appear to be having a little glitch. Please bear with me a moment. There we go. So the PACE program was started in the 1970s by the Asian community. The first PACE program was called Unlock. They are still up and running today. And Unlock has a beautiful meaning, peaceful, happy, humble abode in Cantonese. So the PACE program has grown since the 1970s and turned into a bigger, probably, program than what anyone could ever imagine. And now currently the PACE program operates in more than 32 states in the District of Columbia and has more than 300 PACE centers throughout the 32 states, covering approximately 70,000 PACE participants. So just to show how much like the national PACE has grown, the last statistics we had were from a few years ago, and the previous statistics were 272 PACE sites in 30 states and approximately 55,000 participants. So as you can see, PACE has definitely gained momentum over the years. And in Michigan, there are 14 PACE programs, and we are growing pretty rapidly in Michigan. So this is our latest statistic at the bottom. So participation in PACE has increased 470% from 2012 to 2022, showing how vital it is for the PACE program in Michigan and its people. So part of the PACE program is a all-inclusive care for the elderly. That is the definition of PACE. So we consider elderly for the PACE program 55 and older, which can be really helpful because some other senior programs are usually 60, 62 and older. So with the PACE program, we can reach people who might be considered a little bit younger of seniors. And how we provide services is wraparound support. So we provide care in a home with the whole goal of promoting healthy independence and providing support to hopefully prevent nursing home placement. So when someone is enrolled in PACE, Ryan will talk about this a little bit more, but really the whole goal is to wrap a team around them to help them maintain in their own home. Ryan here.
Let me unmute myself. Yeah, and before I kind of talk about some of those things that we wrap around, and even before I get to this slide here, I want those that are on this call here to just think about for a minute your last experience with healthcare. Whether you were had a dentist appointment and maybe they recommended, you had to have a cavity filled, or you again went to your doctor, your primary care provider for maybe your annual physical, and they recommended some blood work or maybe to see a specialist. Just think about for a minute how that experience went for you and what it was like making that appointment, what it was like making the follow-up appointment, what it was like maybe weeks later, months later when you got the bill, or maybe this is not a bill, it was an EOB for that, and do I pay this and was it approved? Just think about what that experience was like for you. I know for myself and my family, we've gone through it, recently, and it's complicated. And now imagine if you have to go through that same experience and you're living alone, maybe not great nutrition, you're not eating properly, not experienced the best personal hygiene, whether it's bathing. Oh yeah, transportation for that doctor's appointment that you and I maybe were able to make or provide for ourselves or had support. You don't have transportation, limited income. And as that list goes on, it's often the case with our participants that you end up missing doctor's appointments because of the transportation or because of you're getting those appointments mixed up, with that there. Even if you did have, prescriptions prescribed, what was it like to be able to get that? So those are some of the aspects that our participants, are dealing with on a daily basis, and not just one or two of these, but oftentimes multiple of these experience. So as Rashea mentioned earlier, as we kind of go to the next slide, we talk about having those services, of PACE wrapped around you. So I often kind of think of, we wrap the PACE blanket of care around somebody. So I know that having this blanket wrapped around me would be helpful. But again, for seniors who probably have 2 or 3 different chronic health conditions on 8 to 9, medications, having these services already wrapped around them in place. So we have primary care, home care, physical therapy, occupational therapy, recreational therapy, prescription medication. We have our day centers in our clinics. So all PACE programs have a day center and health clinics where we're able to bring participants in, which we find is just as important as us being able to go out into the homes. We can bring our primary care providers and we can bring our physical therapists into our participants' home, but we also can pick them up and use our transportation to bring them into our day centers where they can get some they can get a meal, they can have some social interaction, and also see, their primary care provider, maybe see their physical therapist in our health clinics while they're there. We coordinate with medical specialists. We coordinate nutrition services. The transportation, I find, across Michigan is a huge barrier to healthcare for individuals, really of any income, but especially lower income, and especially as we age and maybe transportation for ourselves is harder to provide. Is a barrier to healthcare for many individuals. So a PACE program provides transportation for all of the necessary healthcare appointments that we provide and recommend. And then social services, both in our centers, as I mentioned, and having those throughout the, plugging individuals into the community as well. So I think that part of the PACE magic is not just having these services that we wrap around individuals, but coordinating them for individuals as well. That can oftentimes be a high stress, high anxiety aspect of just knowing, where do I go? If my doctor recommended, rehabilitation or recommended, medication, well, what kind, where do I get it from? How do I get it? Is it approved? And the fact that for PACE participants, that coordination of care is all under our umbrella, that we're able to walk the person through those decisions, put those in place, and then in most cases provide them for them ourselves, is a game changer, not just for the individual, but for their family members that are trying to piece all of these pieces together through the coordination of care. I think that is it for my 2 slides.
All right, so for insurance coverage, I will go ahead and share about that. For insurance coverages and the amount that you pay for PACE, how does that work? So basically, if you have the dual eligibility for Medicare and Medicaid, you are able to pay 0 or limited out-of-pocket expenses. Also, with Medicaid only, there's 0 or out-of-pocket expenses. Basically, if you are, I'm not sure what's going on with my camera. Basically, if you have Medicaid and Medicare, you are eligible for the program with 0 out-of-pocket expenses. Now, there is a PACE pay as, out of pocket if you don't have Medicare and Medicaid, but most of our participants do have both. They're duly eligible. Enrollment happens on the 1st of every month and is ending on the 24th of the month. So come the 1st of the month, we're getting our new participants, we're signing them up. We are helping them get into the program. By the 24th, all of that paperwork and their assessments need to be done, enable for them to start services on the 1st of the very next month. That is just kind of how we run things, and we work very well with the Medicaid offices to help you get those services if you are eligible, to make you a PACE participant eligibility, so that you can get into PACE. So we work with you on everything. We also try and help get you to other services if we can't help you. But basically, if you have Medicaid and Medicare, you are eligible to be out-of-pocket expense at 0 expenses. And I think that is it for my 2 slides.
So my name is Veronica Horsley-Pettigrew, and so I'm gonna share a story about one of our participants. And I feel this story kind of speaks to everything that we're talking and that we have talked about PACE, and how PACE can make a difference in someone's life and in their family's life for a better quality of life. A few years ago, I used to do assessments, and so I went into a home. It was a very nice home with a family who had taken in grandma. And grandma was pretty young, and she was in her 60s, and they had set up the hospital bed. They were going to use their family room because there was a bathroom near that would be convenient for grandma to get up and as she could, or having her grandchildren help her toilet. But anyway, when I went in, grandma was kind of lying down and was not able to sit up on her own. Well, you figure she's about 66, I think, 66, 67. That's kind of young not to be able to sit up on your own. And she could not stand on her own. It was very disconcerting to me for that to be happening to a young woman. And so I was kind of taken aback by that. So she came into the program. And when she started the program, they had to bring her in a wheelchair. And through therapy, she went from the wheelchair to a walker, from the walker to a cane, from the cane to walking on her own without any assistant devices. This took over 6 months, and I can say now today she is living in her own apartment, independent. She's independent. She is very happy. And what they found out was that she has Parkinson's, but she was seeing different doctors and they were not communicating with one another. So she was over medicated and it was breaking down her body. And so we got her medication because we are the insurer, we provide medication and we have our own pharmacists on staff, that we got her medication balanced out, and physical therapy. Typically in the community, if you need occupational physical therapy, the doctor will give you a prescription for 6 to 12 weeks. The insurance will not pay more than that. But in the PACE program, we have our own physical therapy, occupational therapy, so we can give therapy as long as needed. And so she was able to get everything that she needed, and she was able to get the appointments. We scheduled the appointments for her and make sure we picked her up on the bus. I say to people, wealthy people have nothing on people in the PACE program because they have all the services that money could buy without having to assume all the responsibility, and that you have a group of people taking care of you. So this story is on our website. You can find this story. We went to Lansing in May. We go to speak to the legislators for them to continue to support funding all the PACE programs. And so this person, she was able to speak on behalf of herself and PACE, and what a difference PACE has made in her life and the lives of her family and other people. Thank you.
can go ahead and share a story as well. There are lots of stories. Many of them I was trying to come up with and pick one, but I did just get a message from a gentleman that we have at, as a participant. And when he first started, it was around the New Year. It was right after New Year. He had just got done having COVID. He was very sick. He was also in the hospital for a while, was placed on a catheter. He came in without a primary care doctor, not knowing what to do to get rid of the catheter or to get help with the catheter. The catheter was leaking, so he had a Ziploc bag that he was carrying around to try and take care of this himself. As I said, he was, older. He didn't really understand what was going on or if he needed this catheter. He came to our center and said, I was referred here. I don't know what to do. I don't know how I can, get help. I don't understand any of this. Right away, we definitely gave him a new setup with his catheter and a new kit. And we also found out that he was eligible for both Medicaid and Medicare. He didn't have a primary care doctor, so this was helpful so that we were able to start primary care for him and able to then take on that catheter and all the other issues that he had from the COVID experience he had had. He just sent a message the other day that he is so happy to be a part of the PACE family. Our participants are not just, a participant. We, as that wraparound blanket, we feel like they're all family and they feel like they're family with the other participants as well. So that was just a very heartwarming message that he sent to let us know that he has a real family here at PACE.
Hi, and I'm Rashea from Care Resources PACE again. So this one to provide a little update about our site. So Care Resources PACE currently services all of Kent County, certain zip codes of Ottawa, Barrie, Allegan County. Well, we have grown quite a bit in the last couple years, and so we are actually looking at a second site in Lowell to be opening in fall of 2024. So that will really help our participants who are living maybe in that area of Kent County, but that maybe live in Ottawa County, or I'm sorry, Ionia County, and parts of Barrie County. So they might have a shorter bus ride into the center. So I don't know, does any other PACE program have some updates they would like to share? Or?
I can share that the PACE, we are based out of, Community PACE is based out of Newaygo. We do cover 6.5 counties, kind of bridge the gap between that PACE North and Care Resources, Newaygo, Osceola, Oceana, Lake, Mecosta, those kind of counties right there. And we are looking to open up a new center in Ludington so that we can get those participants from Irons and north up there to our center and not have such a long ride. So we are also expanding.
So this is Veronica with Care Resources PACE. We also, if right now, if someone lives in the Ionia area, Ionia, Barrie, Saranac, Hastings, we partner with a day center, just like home. So we do have a few of our participants that are going to that day center just like home. They're still in PACE, but just like home is in Ionia. So that way the participant does not have to travel to all the way to Grand Rapids if they don't want to. And especially now until we get the new site up and running next fall. So don't be discouraged and say, well, we don't want to have to come all the way to Grand Rapids. We partner with Just Like Home, so you don't have to come all the way to Grand Rapids, except for doctor's appointments, and we will provide transportation. But Just Like Home will pick you up and provide lunch and games and things like that. They're very, very they're an amazing day center, and the owner is very popular in Ionia. Lots of the doctors offices are familiar with her services and the community. So she has a very good reputation in the area of Ionia, Saranac, and Hastings.
And a little report from Northern Michigan. PACE North covers Grand Traverse, Leelanau, Benzie, Wexford, Antrim, Kalkaska, and a little bit of Manistee County. And our 5-year plan is to open a second center, probably in Wexford, so that we can service more of Manistee County and Missaukee County. And again, to keep people a little bit closer to home.
So I'm going to kind of go over a little bit about the income level. So you have Medicare. If you have Medicare only and you don't qualify for Medicaid, there's Medicare and private pay. So we do have a few people that private pay, and the private pay amount will be determined by the zip code that you live in. To qualify for Medicaid, a lot of people in the community don't qualify for Medicaid. If you have income over $1,100, I just found this $1,100, you don't qualify for Medicaid. But in the PACE program, the income level is $2,743, which will allow more people to qualify for Medicaid. You can't have assets over $2,000. You can own one home and one car if you to qualify for Medicaid. So if someone has just Medicare only, and Medicare comes when you're 65, you automatically get Medicare. And so then that's private pay if you have more assets than $2,000. If you have a spouse, that's a different level, and intake can kind of go over, because they have something that's called the community spouse, that all the assets up to a certain point can go to the person who is not in the program, and then they will only assess the income of the person coming into the program. A little bit more complicated, but we have experts that can take care of that, and we do we have our own DHS Medicaid representative that works for PACE, so that we're able to get applications done and through very quickly. Is there a PACE in Muskegon? Yes, there is. Life Circles is in Muskegon, and they have PACE in Holland as well.
I'd like to go over some of those poll questions. And the first one was, does PACE cover over-the-counter medications? Would like to answer.
What's over the counter? What is, I guess I might be a little confused. What's considered over the counter medication? Because if we get a prescription for medication, then we cover that. So would that be something like over the counter? Is that Advil, Tylenol, or something like that?
Yeah.
Oh, okay. So I see where, okay.
So let's say they have a cough or something and they need Mucinex or something like that.
Then PACE would provide that. If it is determined that is needed for healthiness and quality, then PACE will provide that for them.
And they get that at the center? Is that how the medications work?
Yes.
Or if it gets shipped to their home?
Yeah, they will ship. It will even be shipped home. It can be, if they come to the day center, they can take it home with them on the bus. The bus driver can make sure that they have that medication, or it can be mailed. But everything that is needed for the health of the person is provided by Care Resources, PACE, or any of the PACE programs.
Got it.
Yeah, this is Ryan. I'll kind of, add to that. Yeah, I think that caveat being, if our team authorizes and approves it, that it's necessary for their care, we're going to coordinate, we're going to provide it, we're going to pay for it. It's not a matter of somebody turning in receipts for $400 worth of ibuprofen that they went out and bought on their own, like, reimburse me for over the counter. We wouldn't do that, but as long as we authorized it, we approved it, we would again coordinate that, care, providing that, service for those participants and to meet the need.
Good point. Thank you, Ryan.
So the second
And I guess that's with all the services, that as long as it is authorized by the team, and people can use their own physician. As long as their primary physician agrees to coordinate with our medical team, at least twice a year, they can see their physician. And the reason they do that, because once a person comes in the PACE program, any PACE program, the PACE program assumes all responsibility for that person. And so any medication changes, we need to be aware of that so that we can maintain a good quality of care across the board. And so that we know that there's no interactions with medication that we're giving and not aware what the other physician is doing. It has to be a partnership for the good and the quality of the person that we are responsible for.
So that was the third poll question. The second one was, can you be a snowbird while on PACE? So can you go away for any length of time?
So I can answer that one, and it's a bit of a trick question. So if you're on Medicaid in the state of Michigan, you're only allowed to leave the state for 30 days. And you're only allowed to be out of catchment with PACE for 30 days. Catchment is our territory. However, I am currently working with a family that will snowbird, but they will be private paying, and they are going to enroll with a PACE organization in Florida. And then when they come back in the spring, they will enroll with us. I don't think anyone's excited about this scenario, because imagine it's like moving your kid at school in the middle of the school year. But because they're private paying, we're not dealing with Medicaid closing. It is something that we can do. But in general, it's 30 days. So you can have a nice long vacation, you can go for a nice trip, but you can't snowbird if you're on Medicaid.
Yeah.
Which is everyone's thinking about that this time of year here in Northern Michigan. So it's when are we getting out of the cold?
Right. But it's not a problem going away and seeing a son or a daughter or a family member for a week at a time or.
No, it's not. Yeah, we'd certainly want to know so that we can make sure you have medications and things like that. And it can get a little bit tricky if, you end up going to the doctors when you're in Florida. So it's definitely something that needs to be communicated with the team so that we're prepared.
Yeah.
But it can be done.
Great. So I have some great questions here. If you only have Medicare Advantage and no Medicaid, can you participate?
I can start with that one. Short answer is yes. You can participate in PACE. The qualifiers, for PACE are age 55 or older, live in our service area, meet a nursing home level of care, and not in a long-term care facility at time of enrollment. So income, Medicare, Medicaid are not a requirement for PACE. That being said, when we've talked about it comes down to the financial aspect or the cost for the program. And if you are Medicaid eligible, and we can help you get set up with Medicaid if you meet those criteria, there's going to be zero cost for any of our program, our services that we recommend. If you're not eligible for Medicaid, and this kind of goes into one of the other questions here about Blue Cross Blue Shield, if you're not Medicaid eligible, really the only other scenario is you're going to be self-pay, and depending on whether you have Medicare, you have Medicare or not, would determine what that price factor is or the cost factor is for private pay. But that is an option, for individuals. So PACE becomes the insurer for that. So we don't participate with Blue Cross Blue Shield or Humana, whatever your insurance. We become the insurer for that. So it would be Medicaid eligible and zero cost, or Medicaid and Medicare. Or if you're not Medicaid, it would be self-pay, for that.
So if you had Blue Cross Blue Shield, let's just say a Priority Health, you would no longer have that?
Correct. You would, yeah, you would disenroll for that current one, and you would enroll into it'd be with PACE on a self-pay component. Again, without getting too in the weeds on some of the
Right.
details with Medicare Part D and stuff like that. But again, we become the insurance, so you would have this, self-pay, component of anywhere from $4,500 to $7,500, a month, depending on the Medicare, portion of that. Which again, for some, makes them fall out of their chair when they hear that, number as far as the self-pay amount, because maybe they're just over that Medicaid limit. But if their other option is they're looking at self-pay for a nursing home, and in fact, I think there's a Carrier Law commercial that addresses this on TV where it talks about the cost of nursing home, and yeah, you're talking, it's spot on. It's $8,000 to $12,000 a month for a nursing home if you're doing private pay, for that.
Right. Right. What about specialists? When a person has an illness that requires a specialty doctor, does that have to be given up? And if it does, how do you handle that?
Well, that's a good question. It depends. Most of the time, people are able to keep their specialty providers, and that everything is discussed, which is really good. Everything that all concerns are addressed prior to someone coming into the program. So you would know, it won't be a surprise if that is something that we're able to do. I haven't heard that someone is not able to keep their specialty provider, but it doesn't mean that it couldn't happen. But prior to enrolling, you can ask these questions, and if it's not to your what you desire, if you're not able to negotiate, then that's something that you need to really think about. And so I do like that prior to enrolling, they're saying these are the things that we are able to provide. And if there's a specialty appointment, we will schedule those appointments for you. And if a family member is not able to take you to your appointment, we will pick you up, take you to the appointment, and provide an escort to be with you on that appointment. Rashea and I have been escorts when volunteered to be escorts, which is really a rewarding. I would like somebody to go to my appointments, but people usually are working. So, but that's that extra service that we provide, that we have an escort. So I can say probably 90% of the time you're able to keep your specialty provider.
But it seems like before anybody even makes the final decision of enrolling in PACE, everything is discussed, and their physical well-being, what their home situation is, so that there shouldn't be any surprises, just a lot of joy of knowing that all the benefits that they do get from PACE, and it's going to make their lives and those of their family members and loved ones so much easier.
And we've had a family that's been in our program. One of their father has been in a program for over 3 years. And so he lives with his son and daughter-in-law and grandchildren, and they like to go on vacations. And so typically it's for a week. Well, we will make sure that we take care of him for the week that they're on vacation. And the reason we do that is because it supports the family, which supports the person who's in our program in a holistic kind of way. And you want to keep everyone as whole and healthy as possible. And so when you're living with a person who has some memory concerns, that can take a toll on them and the family as well. So you need to have a vacation so you can come back with a fresh look on things and you get a rest. So we are there for everyone, the son, the daughter, the grandchildren, to kind of keep everyone as whole as we possibly can.
As the admissions director of an assisted living community, if I'm not able to help someone due to their income, who should I send them to PACE? So who's the contact person? And how would they find that?
They would call the number here, the 877-264-7223. And there's our intake coordinator, which is Shannon. She's at Care Resources. Shannon schedules a nurse and a social worker to go out and do an assessment to make sure the person qualifies for the program. So she does all the scheduling. Shannon is very good at what she does. So you would call the number and you would get, I think it's intake coordinator is the option. I'm not sure what option you would choose, but it gives you that prompting that if you want intake, choose this number, and then you would reach Shannon.
So I think this is a great point, because sometimes when people need additional services and perhaps can't remain safe at home, and they look for alternative solutions, sometimes they're more expensive than what they can afford. And this would be a great referral for PACE, because they can do the evaluation to make sure they're eligible physically, and pass through, are Medicaid eligible for and then hopefully provide them services if they do qualify in their home, at no cost. And that's really the key. And I know you were talking about different income limits and asset limits as well, particularly for Medicaid. And that's one of the things that we help families kind of work through as well. So when they come to Carrier Law, if you are interested in pursuing PACE as an option, and let's just say you have a home and maybe a cottage, or you have, as David says, life savings, and you're really just not sure, could I qualify for this program? Is it the right thing for me? From the financial end, that's what we help with. And then, as Veronica said, they do, the assessment to make sure that medically you would be eligible. So just wanted to give a little plug there for how we help families. One other question, Veronica said that if a person has income of $1,100 a month, they don't qualify for Medicaid.
That's in the community. Yeah, that would be
community. Okay, yeah.
That's community. That's why, a lot of people don't qualify in the community for Medicaid, is because the income, but to qualify for PACE, and I like that the state has given us more money. It's $22,742. It's not a lot of money, but it is more than $1,100, which gives more people the opportunity to qualify for the program.
I have found that a lot of the families that we serve, it's typically between a Social Security and even if it's just Social Security, they usually qualify. And then if they have a small pension, as well. So it is, that income limit isn't really that low, but it is a barrier for some people, because if you're a penny over, then you don't qualify.
And that is the truth, because we have had a person $1 over, and we have, we go to we have called legislators to say, are you kidding me? It's $1 and this person really needs this program. But I guess it's like with anything else, you have to have boundaries and a limit, because we could say it's $2 or it's $5. It's frustrating, but I respect and understand the boundary, but it gets very frustrating sometimes when you know that someone could really benefit from this program. But that's a hard stop at the income that they say. That's exactly what it is.
Yeah. When will the services in Wexford be available, and can people in Manistee use the Ludington Center? Good question.
We're currently, I'm sorry, go ahead.
No, you go ahead.
We're currently serving Wexford, And I don't have a date on an additional center being open. We've submitted the plan to do so, but we don't have a site or we're not, so I'm calling it a 5-year plan. And as for folks in Manistee, I'm gonna defer to Trista on that. It's gonna depend on if you're in their territory.
Yes, we are expanding. Like I said, we do have a building in Ludington that we are hoping to open, but like she said, it's more of a couple year out plan for that, unfortunately. But we're hoping to get there soon.
This is a really good question because I know you guys all face this. If one spouse has dementia, can he or she participate and live at home?
I'm sorry, I guess we're all kind of looking, yes, if yes, as long as they qualify for the program, and dementia is a qualifier for the program, they can live at home if it's safe, if the person who's taking care of them is willing to do that. I mean, there's caregiving is not for everyone. And that's really the truth. And not because people don't want to do it. It requires a lot. I mean, the wonderful thing about caregiving, if you're in the program with PACE, is that you have support.
Yeah.
And you have someone coming in to help make sure they have medication, make sure that there's a laundry that is done, that there is cleaning, those kind of things, which is really great. And then someone could possibly come in, and so the caregiver can go out to the store for a moment, and things like that. But excuse me, that's the beauty of PACE. But the caregiver has to be willing, because there is no overnight services. We don't do that. We the hours for care, as far as home care, cleaning, and things like that, is determined prior to a person coming into the program. So we can say we could give you maybe 4 hours, but it depends on the care plan. Everyone's care plan is unique to them. And so that information is, once the assessment is done by the whole team, then it is determined how much home care is needed, how much therapy, everything is needed. And all that information is gone over prior to the person coming into the program, so that they can either agree or not agree to come in. But certainly, if the person wants to do that, we are there to support, to help them with their loved one. That is what we do.
Right.
Just to kind of add on that, we do not go into the home necessarily unless, it's scheduled prior, like she mentioned, but we do have a nurse on call. So if there are issues that do happen after hours and you're not sure what to do, or you need some help, there is a nurse on call that they can call. And then back to the enrollment for the Medicaid, I'm sure all the PACEs are about the same, but if you're not sure about the Medicaid and you don't know how to go about figuring that out, contact our enrollment coordinators, because they are more than willing to sit down with you and go through your income with you and fill out a Medicaid application and kind of explain the differences between the community and the PACE Medicaid and kind of help you figure out. And then from there, we would obviously refer you on to carrier law if you were above and over, and try to figure that out with them.
So I saw that there was a question about what is the monthly pay for private pay. So it will be determined by the zip code, but I'll give you a range. So that could go up to like 5,000 and something. I'm just going to say 5,000 and something per month, but which is not much when you think about a nursing home stay is what, the 12 to 18,000. It could go up more per month, and you're not being able to stay at home with supportive services. So I mean, that's kind of how I look at it, and it will, like I said, will vary based on the zip code. The state determines. We each individual PACE program does not determine the amount of the private pay. That is determined for us. So, which I think is great, because then we don't have to, we're not negotiating. This is just across the board for everyone. So it makes it fair, whatever the cost is. I hope that helps.
Yeah.
Yes, and the number that is up, this 877 to MI PACE, this is kind of like a PACE hotline number. So there are multiple PACE programs that cover different areas on this webinar. So you can call that number, and if there's a PACE site in your area, they will link you up to the intake coordinator or whoever handles the intakes at that particular site, so they can again help answer some of the Medicaid questions and then just kind of get the process started. I apologize, I was having a little bit of technical difficulty earlier, but someone had a question about I believe a spend down in the community. So sometimes people do some people call it a Medicaid deductible or spend down. So sometimes if people are living in the community and they are over like the allowed amount for community Medicaid, they could get a spend down, and that's determined by the state. But for the PACE program, if you are under the income limit and you qualify for Medicaid, you don't have a spend down or a deductible Medicaid if you're enrolled in PACE. So I apologize, I couldn't answer that question when it popped up, but I wanted to make sure I clarified that.
So we just launched a poll. It's always great to know if you found this a good use of your time, and if we got your questions answered. I really want to thank Veronica, Michelle, Rashea, Ryan, and Trista for spending their time with us this afternoon.